Hi, I'm Kay. So my presentation will be on toll-like receptor 5, or Tlr-5. So first things first, what is a toll-like receptor? A toll-like receptor is a class of transmembrane proteins that recognizes pathogen-associated molecular patterns, also known as PAMPs, that are on infectious agents, and they help to activate the innate immune response by mediating the production of cytokines, which are small proteins that are important in cell signaling and that affects how other cells behave. When a microbe breaches physical barriers like the skin, it's the TLR's job to recognize it and activate immune cell responses. Tlr-5 is located and expressed on the surface of the cell of macrophages, dendritic cells, and intestinal epithelial cells. What's important about Tlr-5 is that it recognizes bacterial flagellin for both gram-positive and gram-negative bacteria. So whether a bacteria has a thick or thin peptidoglycan layer, it doesn't matter. And bacterial flagellin is a protein monomer that makes up the filament of bacterial flagella, which is on motile bacteria, so any bacteria that can move around. The receptor is activated by monomeric flagellin, and that is done through the enzymatic breakdown of a flagellated bacteria. When Tlr-5 is activated, it stimulates pro-inflammatory cytokines like TNF-A through signaling from the adaptor protein MyD88. TNF-A is tumor necrosis factor alpha and is a central regulator of inflammation. Also, when Tlr-5 is activated, it mobilizes NF-kappa B and it activates inflammatory-related target genes. So when the gene is mutated, it's been shown that an individual has an increased susceptibility to Legionnaire's disease, which is a type of pneumonia, and systemic lupus erythematosus, which is an autoimmune disease where the immune system mistakenly starts to attack healthy tissue. NF-kappa B is a protein complex that controls cytokine production and cell survival and also the transcription of DNA. If it isn't regulated properly, it can be often linked with a myriad of awful things such as cancer, inflammatory, and autoimmune disease, to name a few. For Tlr-5 to be efficient in ligand recognition or signaling, it requires a co-receptor or adapter molecule to help facilitate it. So that's why the adapter protein MyD88 is important. The epithelial cells are cells that help protect organs, and they're aligned in hollow organs and glands, and also on the outer surface of the body. Tlr-5 that are on gut epithelial cells can recognize flagellin and protect against intestinal inflammation. Mice that mutated who lack the Tlr-5 receptor have a greater chance of experiencing inflammatory bowel disease and are at risk of being infected with salmonella because they don't have the protection that normal mice do.